Welcome to The Explainer. Today we are diving deep into heart disease, but probably not in the way you're used to. We're going to explore the radical claim from a practicing heart surgeon that we've been fighting the wrong enemy this whole time.
So you just heard it right there. That's a direct quote from Dr. Philip Ovadia, a surgeon who is literally inside people's chests, operating on diseased hearts day in and day out. It's a huge claim, and it's the core idea we're going to unpack today. The pretty shocking possibility that our standard approach to heart disease is just fundamentally wrong.
And look, this isn't just some abstract academic debate, right? Heart disease is still the #1 killer across the entire globe. The stakes just couldn't be any higher, which makes finding the true cause absolutely critical.
All right, so let's dive right in. The very first thing Dr. Ovadia takes on is what he calls the cholesterol myth. He says we need to completely rethink its role in the body.
You know, for decades, we've all been told the same story. High cholesterol is the bad guy, the villain that gunks up our arteries. But Dr. Ovadia just completely flips that script. He says cholesterol isn't the vandal causing the damage, it's the body's repair crew, the first responders showing up to patch an injury that was already there.
And this really gets to the core of it. When surgeons like him actually look at plaque, it's not just a big glob of cholesterol. It's this complex crime scene with calcium, blood clots, and all the telltale signs of inflammation. So to him, blaming cholesterol for the plaque is like showing up to a car wreck and blaming the paramedics. Yeah, they're at the scene, but they didn't cause the crash.
Which, of course, brings up the million-dollar question, doesn't it? If cholesterol is just the repair crew, then what's actually injuring our blood vessels to begin with?
So if cholesterol is off the hook, who's the real bad guy here? According to Dr. Ovadia, the medical system has been chasing a symptom, not the actual root cause. The real damage, he argues, is driven by two key underlying conditions.
And here they are: chronic inflammation and insulin resistance. From his point of view, as a surgeon, pretty much every single person who lands on his operating table is dealing with one or, more often, both of these metabolic problems.
Okay, so how does this actually happen? How does this attack on our arteries work? Well, he says it's a three-pronged assault. First, the high blood sugar from insulin resistance, it physically scours and damages the delicate lining of your blood vessels. Second, it tanks your levels of nitric oxide, which is this crucial chemical that keeps your arteries flexible and protected. And third, this whole process kicks off a state of chronic, simmering inflammation throughout your entire body.
So that naturally leads to the next question, right? If inflammation and insulin resistance are the real problems, what in our diet is actually causing them?
Well, Dr. Ovadia points his finger at a few key things in our modern diet. You've got the obvious ones at the top, the ultra-processed carbs and sugars. You know, breads, pastas, cereals that are known to spike your blood sugar. But he also calls out something that many people think is healthy: industrial seed oils, like canola, corn, and soy oil. He argues they are profoundly inflammatory on a cellular level.
And he takes this idea about seed oils a step further, with a really interesting theory. He now suspects that the damage from these oils might be the first domino to fall, that they disrupt our body's machinery so much that we can't even handle sugars properly anymore, which then creates this awful, vicious cycle of metabolic chaos.
Okay, so if that's the stuff to avoid, what does he say we should be eating? And this is where things get really controversial, where his advice basically flips decades of dietary wisdom completely on its head. I mean, look at this. The difference is just black and white. For years, the advice has been low fat, limit red meat, limit saturated fat. Dr. Ovadia suggests pretty much the exact opposite: a diet that's high in healthy fats, low in carbs, and actually prioritizes animal-based foods.
So his good food list, it literally looks like the bad food list from maybe a generation or two ago. We're talking beef, eggs, lamb, real butter. So why? The argument is that these whole foods are not inflammatory. He says they help your body reverse insulin resistance and provide vital nutrients, all without causing that initial arterial damage that he believes is the real root cause of heart disease. All right, so this is all well and good, but how do you actually know what your own risk is? If the standard cholesterol panel isn't telling you the whole story, what should you be looking at instead?
Well, Dr. Ovadia suggests a completely different set of tests, ones that focus on your metabolic health. He zeroes in on these 5 specific markers that he believes paint a much more accurate picture. He looks at your triglycerides and your HDL, your good cholesterol, but specifically the ratio between them. He says that's a huge clue for insulin resistance. Then, he insists on checking fasting insulin as something called HSCRP, which is a direct measurement of inflammation in your body.
And for anyone who's still not sure, he points to what he calls the ultimate tiebreaker, a coronary artery calcium scan, or a CAC score. See, this test is different. It's not a proxy for risk, like a blood test number. It's an actual picture that measures the amount of hard, calcified plaque that is really inside your arteries. A score of 0, he argues, is an incredibly powerful sign of very low risk, no matter what your cholesterol numbers say. So to wrap this all up, by totally shifting the blame from cholesterol to inflammation and insulin resistance, Dr. Ovadia is really throwing down the gauntlet. He's challenging decades of public health advice, and he forces all of us to ask a really provocative question about our #1 killer. Is it time to rethink everything we've been told?